Dr. Ken Landau. Thanks for watching. Let's talk about Cymbalta, or Duloxetine. This is a drug that gained marketing approval by the Food and Drug Administration in 2004 as a treatment for major depressive disorder, depression, and for diabetic peripheral neuropathy, and then later for treatment as an anti-anxiety agent, a treatment for pain in fibromyalgia, and treatment for low back pain. The drug company wanted it used for stress incontinence, but the Food and Drug Administration said no. Actually, when the drug was first presented to the Food and Drug Administration, they said the dose is too high, it causes high blood pressure, there's the potential for liver toxicity at the dose you want, especially if consumed with alcohol, and not only that, you guys have some problems with appropriate manufacturing techniques. Well, the FDA and the company finally got together, came out on the market, and by 2009, there were about 3 million people each year taking that drug, and about 400,000 of those people were taking it for inappropriate reasons, for non-specific musculoskeletal pain, for headache, maybe a little bit of nerve pain. But it was selling at a rate of about $5 billion a year, $4 billion of that in the United States. Also important to realize that the drug was such a big seller that it made up about 15% of Eli Lilly's sales. Now, the drug fits into the category that we call the SNRIs, selective serotonin and norepinephrine reuptake inhibitors. That's like an SSRI, that's Prozac and Paxil and Celexa. Well, this does a little bit more. It also works on noradrenaline or norepinephrine, and also maybe a smidgen on dopamine, but no other area of the brain. Well, the serotonin is important because it's a neurotransmitter, and it's important in mood regulation and gastrointestinal function, and maybe pain perception. And the noradrenaline, or norepinephrine, is also very important. It's not only a neurotransmitter, but it's a hormone as well that works obviously in the brain. It's important in cognition and thinking and blood pressure and perception of pain and a series of biologic reactions. Well, let's look at it as an antidepressant. Does it work very well? The company says yes. Our studies show that the drug is a very good antidepressant, and it works in more than 55% of the cases. Well, the company sort of used their own standards. They didn't use the standard method that was then current for evaluating antidepressants. So, since the company funded the studies and since the company judged what kind of comparison scales they should use, yes, indeed, it came out as a relatively good antidepressant. Now, more critically evaluating the drug, it was found only to be a smidgen more effective, if that, compared to a placebo therapy. And even while people had depression, if it got better while they were taking the drug, they had about a 20% chance of relapsing right on therapy. So the Cochrane group in 2012 evaluated the drug compared to all the other antidepressants, and it said it's no great shakes, and it actually wasn't any better than the Prozac or the Zoloft or the Celexa or any of those other newer antidepressants, but they said it has an increased incidence of side effects, and as a matter of fact, they didn't recommend it as a first-line antidepressant. But because it was so heavily advertised, because it was on the television all the time, people saw it, people and the doctors prescribed it, and all of a sudden we had a drug that was used and thought to be very good, when in reality the quality of the evidence and the supporting material was relatively low. And as far as SADS is concerned, the seasonal affective depressive disorder, well, it doesn't seem to work very well in that either. Now, it's important to realize that there's this condition called bipolar disorder. Bipolar disorder is depression plus mania. Well, sometimes it presents as depression, and you don't know that you're going to be subject to mania later on. And if you take the drug, it might precipitate attacks of mania. That's very important, so something to be careful of. So how do other people rate it? We already said that the Cochrane group said, not so good. Well, the International Journal for the Society of Pharmacoeconomics and Outcomes evaluated it, and they found that Effexor actually was more impressive as an antidepressant. And then the Agency for Healthcare Research and Quality evaluated the drug, and what they said is that the quality of the evidence suggesting it's beneficial is really poor to fair. Drug doesn't seem to be any better than, say, Effexor, and as a matter of fact, both of them seem to be inferior to the older tricyclic antidepressants that have been around forever. Well, in depression and anxiety back in 2012, it was evaluated, and actually all of the antidepressants were found to be about the same, so it didn't seem to make any difference whether you were taking Duloxetine, Cymbalta, or Effexor, or Wellbutrin, or whether you were taking Trazodone, or Paxil, or Prozac. They all seem to work basically the same. Well, how does it work for anxiety, generalized anxiety disorder? Again, if any benefit, it's a modest benefit over placebo. And even people who have the generalized anxiety disorder who seem to do well, when they continue the drug, they can also have relapses right on therapy. And as a matter of fact, the Canadian Psychiatric Association guidelines, they don't recommend the drug. And the international publication known as the Maudsley Prescribing Guidelines, they rate all of the psychotropic drugs. They're not too hot on this drug either. Well, that's a couple down. How about diabetic peripheral neuropathy? Well, we know diabetes affects about 2 million people every single year who get that diagnosis, and about 25 to 50%, so a quarter to half of the people, going to ultimately develop the diabetic peripheral neuropathy. It's a loss of sensation, the burning, the tingling, the aches, the shock sensation that occurs specifically in the feet, can occur in the hands, the diabetic peripheral neuropathy. Well, the problem with this is, number one, that it's a neuropathy, and number two, neuropathies aren't specific to diabetes. Neuropathies could be affected or associated with cancer or HIV, the diabetes, of course, radiation therapy or surgery or inflammation or some kind of injury, and the quality of the evidence looking at Cymbalta or Duloxetine in the treatment of diabetic peripheral neuropathy, number one, shows that a higher dose doesn't get any better than the standard dose. At a low dose, doesn't seem to work. And at the recommended dose of 60 milligrams once a day, well, it takes 5 people to get one patient who has around a 50% improvement. So it works a little better than a placebo maybe, but again, isn't all that impressive. And as a matter of fact, the likelihood, if you have a diabetic peripheral neuropathy, that you get 100% relief from this drug, that you'll be cured, that the symptoms will go away, less than about 15%. Well, comparative studies, again, show that the old-fashioned tricyclic antidepressants, the drugs like imipramine or amitriptyline, they seem to work even better than the Cymbalta or the Duloxetine. And Prescrire International shows that, well, maybe you get some moderate relief, but it's clinically insignificant. And as a matter of fact, the results of the trials are pretty unconvincing. Well, how about pain? Is it good for pain? Well, interestingly enough, what the company did was when they were evaluating people for depression, they got the novel idea, let's ask them about pain. That hadn't been done before. So none of the antidepressants looked at people to see whether they were in less pain after taking the drug. Well, of course, if they're depressed, we know that pain is going to get worse. So when they were doing the studies for depression, the company found that when they asked about pain, it seemed the shoulder pain got better, the headache pain got better, the low back pain got better. So it seems that they might have a good idea here. Well, we know that it was approved for diabetic peripheral neuropathy and fibromyalgia, but how about chronic low back pain? It finally got approval for that. The FDA said, on the osteoarthritis pain in the knee, they said, come on, you really don't have the good information that says it works. The drug works maybe about 38% of the time, and a placebo works about 33% of the time. So it doesn't seem to work all that well. But they did get approval for low back pain. And it was found by the company studies that it was a little better than placebo, but still only about a third of the people who were taking the drug for low back pain seemed to get any better. And as a matter of fact, in the European Spine Journal, in research funded by the company, the research showed that the drug wasn't any different than taking an aspirin or an anticonvulsant or an antidepressant of any kind, or even glucosamine. So it doesn't seem to work all that great for pain either. How does it work for pain? Well, probably as an antidepressant in those cases where it seems to work. Now, for urinary incontinence, they wanted to make a big push, but unfortunately for the company, the data really didn't show that it was any good. And as a matter of fact, as far as the pain is concerned, when they went to the advisory committee of the Food and Drug Administration for low back pain, it was an 8-6 vote in favor of the drug, but it was turned down, as I said, for osteoarthritis of the knee. Actually, in 2010, Forbes magazine put this as one of the most misrepresented drug ads. They said, as a depression hurts, that was the name of their advertising gimmick, that really wasn't legit. And the Food and Drug Administration said that they were misrepresenting their claims, they were overstating them, they were omitting significant risk information about the drug. And they claimed that there was a 50% of the patients who were getting at least 30% reduction in pain. And the Food and Drug Administration says, you don't have any information to suggest that that's true. And as a matter of fact, side note, around that time, the drug company had to pay almost $1.5 billion for misrepresenting another one of that drugs. Well, let's turn now to fibromyalgia. 2% of the population, mostly middle-aged women, suffer from fibromyalgia, also associated, it seems, with irritable bowel syndrome, chronic fatigue, temporomandibular joint pain. These people have widespread somatic pain. And they have sleep dysfunction, they have memory problems. Unfortunately, we don't have a good diagnosis, a good method of making the diagnosis. It's just people who seem to have widespread pain and maybe have certain areas, 11 of 18 areas, specific areas of the body, where you push on them and it seems to hurt. Well, in studies that were done, the company showed that if you treat 8 people with fibromyalgia, one of them might get about 50% better. So modest benefits. But it seems to work better in people who have depression. So the question always comes up, is this drug really just treating the depression, or does it have anything specific to do with the fibromyalgia? As a matter of fact, it is not approved, let's say in Australia, for treatment of fibromyalgia, and Prescrire International showed that it's ineffective for this kind of treatment. And as far as the stress incontinence that I mentioned a little while ago, well, it seems that there are too many liver problems, too many suicidal events, too many side effects with the drug, not approved. What do we know about the drug? Well, it's going to not work as well in people who smoke cigarettes because it's not going to be metabolized in the same way. It has a basically 12-hour half-life, so you can take just 1 pill a day, extensively metabolized in the liver, which means if your liver doesn't work, you shouldn't take the drug. About 70% is going to be excreted in the urine, which means if your kidneys don't work, don't take the drug. Food seems to have relatively little effect on the concentration of the drug. It's available in 20, 30, and 60 milligram tablets. There's no evidence that taking any more than 60 milligrams is helpful, but there is evidence that it might be harmful. You should swallow the pills. You shouldn't chew the pills. Now, if you're pregnant or if you're nursing, do not take this pill. It can cause significant problem to your infant. Drugs associated with a lot of side effects. Most of the people who take the drug are going to have at least one side effect. Sometimes it's going to make them too sleepy or make them feel too awake or give them a headache or cause a constipation or dizziness or make them feel sick. And it seems to have effects on sexual function, more so in men than in women. In 5% there will be erectile dysfunction, another 5% lack of orgasm, another 5% lack of ejaculation. But somewhere around 20% of the people or thereabout are going to suffer from dizziness and or headache and or a dry mouth and or nausea. And about 10% are going to either be very sleepy with the medicine or constipated with taking the medicine. Now, the Food and Drug Administration specifically says, hey, if you take this drug, you should be very cautious because it can cause liver disease, especially if you drink alcohol. It can cause hypotension. When you stand up, you might faint or fall down, especially if you happen to be taking an anti-hypertensive drug. It can cause abnormal bleeding because the drug interacts with serotonin, and the serotonin can affect the platelets, and the platelets are necessary to cause clotting. So if you happen to be taking aspirin or if you have a history of gastrointestinal ulcers, maybe you got to be a little bit careful. It can cause very severe skin reactions. It can precipitate the mania that we talked about if you happen to have bipolar disorder. If you happen to have a history of seizures, can precipitate seizures. It can cause low blood sodium. And if you get too low a sodium, then it can cause headache or weakness or hallucinations or seizures or syncope or respiratory arrest. And especially if you happen to be relatively young, less than say age 24 and taking the drug, increased incidence of suicide. So young people need to be monitored. And anyone taking the drug who all of a sudden becomes agitated or has panic attacks or insomnia, irritation, irritability, hostility, impulsivity, well, those people might be at higher risk for suicide. It can interact with certain other kinds of drugs from Cipro to cimetidine or Tagamet and some of the antidepressants, and you got to be very careful. You shouldn't be taking it with an SSRI. If you were treated for depression with an MAO inhibitor, a drug like Parnate or Nardil or Marplan, well, you shouldn't take the Cymbalta within 2 weeks either way of taking those kind of drugs because it might precipitate very horrible side effects. And if you take this drug, it might lead to something known as the serotonin syndrome, either taking it by itself or especially if you happen to have headaches and you take a triptan, or if you take lithium, or if you're taking fentanyl with the drug or tramadol. What is the serotonin syndrome? Serotonin syndrome can cause mental status changes. It can cause agitation and hallucinations and delusions and coma. It can cause instability of your autonomic nervous system, so your blood pressure can go up, your heart rate can go up, you can get dizzy and sweaty and flush. And it can cause problems with your muscles. It can cause tremor, and it can cause rigidity of the muscles, incoordination. Your reflexes might be increased. You might actually have seizures. And it can cause gastrointestinal disorders, nausea and vomiting and diarrhea. And if you happen to be taking the drug and you want to stop the drug, there is something known as the Cymbalta Discontinuation Syndrome. The company says that's not really a problem. Fewer than 1% of the people. Actually, in clinical experience, it's up to around half of the people who are taking the drug can't get off it right away at least, because if they do, it will precipitate, in many cases, this Cymbalta Discontinuation Syndrome that may be manifest as dizziness and headache and nausea and vomiting, and irritability, insomnia, anxiety. It can cause excess of sweating, can cause mood problems, seizures, headache, nausea. It can lead to tiredness, loss of energy. It can lead to irritability, and especially electric shock-like, or what we call brain zaps, where you have all of a sudden, especially with movement, you just feel like you've been zapped by something. Well, you can overdose on the drug too. So you got to be careful. And not only if you overdose on the drug, you could have side effects that could be severe. They could range anywhere from vomiting and fainting to racing heart or tiredness or seizures or coma. So the drug has an awful lot of side effects, an awful lot of baggage associated with it. What's the dose? Well, 60 milligrams for most things, most diseases, is the most appropriate. It could be as low as 20 or 30 to start, maybe slowly increase to 60 milligrams as appropriate. It's kind of an expensive drug. Even the generics are expensive. Least expensive probably is at Walmart for $133 cash. Most expensive generic would be at Walgreens, $250 cash. But with a coupon from GoodRx, you could get it for as little as $15 to $20 a month. But if you want the brand name, instead of Duloxetine that I just mentioned, if you want to go to the Cymbalta, you could buy that for somewhere north of $250 either with or without a coupon. Now contrast that to, say, Celexa or Prozac. You could get those for about $20 a month. So going back in summary to Prescrire International, what do they say? Well, they say duloxetine is no better than the other available antidepressants, but it's associated with more side effects, so they recommend against using this drug. Actually, they put this on specifically their list of drugs to avoid, and they say that in practice, duloxetine, well, it currently has no place in the treatment of either depression or diabetic neuropathy. So yes, indeed, they can advertise the drugs, they can say all sorts of wonderful things about the drug, and yes, we know there are placebo effects, but when it comes right down to it, does the drug really work as stated? And the answer is, it's sure pretty unimpressive. Anyway, thanks for watching. I'm Dr. Ken Landau.